Thinning hair is a problem for millions of men and women across the United States and all over the world. So today I'm going to show you how you can thicken your hair without going under the knife. My name is Dr. Anthony Youn, and I'm known as America's holistic plastic surgeon. I help health-conscious women over 30 look and feel their best by teaching them a holistic approach to health and beauty. And today we're going to go over how you can thicken your hair without surgery. These are proven techniques. These work, and you don't have to go under the knife to thicken your hair. So the problem basically is that 320 million Americans have thinning hair. And it's men, it's women, and this is a problem that affects so many of us, especially as we get older in life. Well, we don't have a solution for basically baldness. If you are a gentleman and you've got a huge bald spot on your head, none of these techniques unfortunately will work. But if you're like most Americans who have thinning hair, you've got hair that's a bit sparse, that's a bit thin, that's not as thick and lush as it should be. You may have patchy areas where you don't have hair. These things that I'm going to show you today can definitely help you. Okay, so if you've got an area that's pretty big and there's nothing there, you're like Kojak or The Rock, then unfortunately, you've got to, if you want hair there, you've got to undergo surgery like hair transplants. But for all of those of you who don't have that, take a peek at what I've got here because it's going to definitely help you. So the first thing that you can do is de-stress. So a lot of us, we lose hair, we have hair fall out when we're in periods of extreme stress. And sometimes it's not necessarily even just, let's say, an event like somebody close to you dying or losing a job or a divorce. Sometimes it's just the chronic effects of just being in a high-stress job, being in a stressful marriage, having kids, that can cause you to lose your hair. And it's this process that we call telogen effluvium, and this happens to people. And unfortunately, there's no way to really diagnose it except just knowing that you are having a lot of stress in your life. So if this describes you, then I would encourage you, see a therapist, meditate, do yoga, exercise, do those things that can help you to de-stress. Get yourself out of that stressful job. Do what you need to de-stress, and you just may find that your hair actually gets thicker. Well, nutritional supplements are a great way to improve thinning hair. A lot of the causes of thinning hair, especially that we see in a lot of my followers, a lot of my patients who are women over the age of 30 and over the age of 40, can be nutritionally based. So an iron deficiency, vitamin D deficiencies, those are pretty common causes of hair loss, especially in people as they get older. And so one thing that you can do is use a good nutritional supplement. The one that I recommend, really which is the one that's the newest, most advanced supplement for hair out there, is called Nutrafol. Nutrafol comes in a formulation for men, and it comes in a formulation for women. And this contains a lot of different things, from vitamins and minerals to biotin, and basically everything that you need to help you to thicken your hair if what your issue comes down to nutrition. And even if you're not sure, it's great for your skin and for your hair. So would encourage you, if you've got thinning hair, take a look at Nutrafol. You can buy it online. We have it at our online store at dryounonline.com. We'll have a link on the caption for this video. And like I said, they've got it for men, and they've got it for women. And the studies show that after about 2 to 3 months of use, that you can get thicker, more luscious hair by taking it. Well, the third thing is topical rosemary oil. Now, what you're not going to find on my list of things that you can do to thicken your hair are prescription medications, okay? Because there are other options for you other than putting yourself chronically on a prescription medication. There was a study that compared topical rosemary oil to minoxidil, which is a main ingredient in Rogaine. And this study found, it really compared head to head how rosemary oil, topical rosemary oil applied to the scalp versus topical Rogaine, or minoxidil, the active ingredient of Rogaine. And it found actually very similar, equal results. So applying topical rosemary oil, which is completely natural, to your scalp has the same effects as minoxidil, but with one caveat. It caused less skin irritation and itching than minoxidil. So if you want to avoid the chemicals and the prescription products, try topical rosemary oil. Try combining it with a nutritional supplement like Nutrafol, and you're going to be doing hopefully really, really well as de-stressing. Well, what's number 4? Low light laser therapy. Now, this started out as a bit of a joke way back in the day, where you may have seen advertisements on late night TV for this comb that had a laser attached to it that you would comb through your hair, called the Hair Max laser comb. And it was on different infomercials, and some people poke fun at it. Well, the crazy thing is that there are many, many scientific studies in peer-reviewed journals that show that low-light laser treatments, like what is used with the Hair Max laser comb, actually work. They can actually thicken hair, and we believe that this low-light cold laser, so it's not a laser that burns your skin or feels hot, it's cold on your skin, but this laser can actually cause the hair to go into a growth pattern, okay, and to go from a, let's say, telogen or a kind of quiet phase to go into a growth phase. And so low light laser therapy, great option. These are same things. You can still buy the Hair Max laser comb today. They have now much more advanced versions over what they had before. There's one that is made that's like a band over your head as well. There's also baseball caps, one called the laser cap, that has, if you take it and you look inside of it, you can actually see all of these laser beams that you put onto your head, and this stuff actually works. So if you've tried the de-stressing, if you've tried the Nutrafol, if you've tried the Topical Rosemary Oil, and it's not quite getting you there, then I would recommend take that next step to low light laser treatments. Unlike the other ones, this is going to be pretty expensive. To get a good laser cap, you're talking probably $500-ish, but it's better than surgery. Well, what if the low light laser therapy doesn't work? What else can you try? Platelet-rich plasma. So platelet-rich plasma, or PRP, basically is your own tissue, where we basically draw your blood, we spin it down, remove the platelets, which are chock full of growth factors, and that is actually injected into areas of your scalp, and for some guys, even areas of their beard, to grow hair. Studies are showing that it definitely works. I know of a lot of doctors who are doing it. I, at this time, am not doing it in my practice, but I've heard from many of my colleagues who swear by and say that injecting PRP into the scalp works really well. Well, this is a great regenerative therapy. This is using your body's own regenerative mechanisms to actually make it younger and to help grow more hair. So if those other options aren't working, then PRP is definitely an option. Keep in mind that this is not permanent, okay? And most doctors recommend doing PRP at least twice a year, sometimes more often. So definitely you have to keep in mind that you're going to be spending a good amount of money on this, because it is a minimally invasive treatment and a doctor or a nurse typically has to do it. But it definitely works. So hopefully this has been helpful for you. If you've got issues with hair, try those less invasive, easier things first, going up to the PRP. If you have got areas of baldness, then you want to consider going, unfortunately, with surgery, and we'll do a video on that later. If you've enjoyed this, please subscribe. Check out these other videos coming right up.